Can you tell us more about your concern? Because your Facebook post has been shared a lot nationwide today. What's your exact concern?
Well, it's a bit surprising, actually. Can you hear me?
Yes, very clearly.
Okay.
Yeah.
It was very surprising, actually, that it was shared so much, as my likes are normally in the range of 10 to 50. So it is really out of frustration that I posted it last night. As you know, the incidence of patients coming to hospitals is increasing, and for medical staff, we are lacking all the equipment, the N95 respirators, the PPE suits, and everything else. They're severely lacking, and also the rapid tests, which to a lot of people seem to be one of the options to detect early disease or even sort of asymptomatic disease, such that you could quarantine them or isolate them. So, a lot of other countries have that, and ours hasn't so far. We've been relying on PCR tests, which is very overloaded at the moment. Mm-hmm. And so there's a question of where are the rapid tests that other countries may have used, and why are they being stuck in an emergency situation like this? And the other issue is that yesterday I heard some friends, two definitely separate friends on that day and one previously, about trying to import medical equipment like face masks and PPE suits to donate to hospitals, and they couldn't because of either the high VAT tax or because when they did bring it, they just got taken away, maybe because it's a controlled product. And it was sort of a bit frustrating about that, because at the moment everybody should be helping and trying to make it possible for medical staff to save as many people as possible. So that's really sort of the background of why I posted it. Really.
You're talking about the rapid test or the mass testing, right? So what do you think is preventing us from doing so in Thailand? And in practical terms, can you explain to our audience as to what rapid test would imply?
So as far as I understand, a rapid test is, so the current testing by PCR, which is very accurate molecularly, but may not be so accurate at all because of the way the sample is taken. The sample is taken by having a swab put into your nose, to the back of your nose, and sort of twirled around to take a sample, and then that's taken to be analyzed. Not only that, sometimes it's negative. The people who have it done can sometimes cough or sneeze, and it's a big worry for the people doing the test as well. So an alternative test which is cheaper, because at the moment, I'm not sure how much the PCR test is at the moment, but it's in thousands range. But a cheaper test, a quicker test, the PCR test can take from 6 or 7 hours to, if sent from outside, a day or two, or maybe 3 days, like someone had the problem this weekend. So a cheaper test, a more rapid test, and a less dangerous test would be something very useful to treat, particularly when there's evidence from other countries, such as Korea, who have used extensive testing to try to isolate and cut down on the infections. And there's a nice report, I haven't seen the actual study, but there's a nice report from Italy in the news that by testing everyone, they managed to clear the virus from one of the villages, one of the towns there. But okay, that's in the news. I didn't see the report.
So actually, right now, we are lacking equipment of test kit of rapid test, or we don't have enough lab for the test?
So up to now, as far as I understood when I posted it yesterday, I did ask someone at the Thai FDA or your what the situation is. Now, there may be some misunderstanding, but at that point, they said that there were tests in the pipeline being processed but hadn't been passed. But today, I've spoken to someone from the ministry, and they said that 4 tests have been passed, one of which has been passed conditionally, so 3 have been passed unconditionally. So that's the news. I wasn't aware of that, and I'm not sure how many people were, but that's as far as I hear. But maybe we need a confirmation again tomorrow morning from the department.
Yes. As far as you can see, what's the situation, what's the difficulty that the medical personnel in Thailand are facing because of lack of rapid test?
Well, I think there are 2 things. One is obviously diagnosing people quickly and safely and accurately. Some tests may not be so accurate, and which is why they may not have passed. But apparently the 3 tests have passed and appear to be accurate enough. So for doctors, it's difficulty in trying to control the disease if you don't know who has it. And if it's expensive, not very many people are tested. So you have to wait until they have a lot of symptoms and come to you. But we know from other reports that coronavirus does not necessarily have to give you severe symptoms. There's a whole iceberg of people with minimal or no symptoms as well, and they're the ones that we're worried about spreading. So it would be, for me, this is my own thinking, that we lock down, so people who have the disease may turn up and people won't spread it during that time. But how long we're going to lock down for, and how are we going to control imports of the disease? So we need good testing and rapid testing to be able to control that. So that's my view. And also, the difficulty of testing for both the doctors and patients, I think, and not knowing whether it's positive or not.
But your view is it being shared by the larger circle of medical expertise?
So
your view about the need for rapid testing, right? Is it something that being shared among the larger quarters of medical expertise?
Well, I think my question reflected a lot of people's questions, which is the only reason why I can explain that it was shared so commonly. My posts aren't normally shared. So I suspect that a lot of people had the same questions.
Okay.
And I think, as far as I'm aware, there are 2 Thai products being made and ready soon. So one from Chulalongkorn Hospital. I think they're very close to deployment. And there's one from Mahidol Silraj Hospital. And that's, I think, a bit further away. So I think people are interested in using it, and from the individual posts that I'm getting, so a lot of people are glad that I've asked the question and whether we're going to get it and that sort of thing. But I'm not sure about the strategic side. I don't communicate there. So, but I think one thing that's important is to actually have a strategy of where this would be used. Will it be refunded? Will it be subsidized, or is it privately paid for only by people who want to pay for it. So I think the important thing is to have a strategy of how we're going to use this to control the disease, particularly after lockdown. I mean, it can be complementary to the lockdown.
And are we still in golden opportunity, as some medical doctors explained yesterday? Do you see that if we introduce rapid testing, perhaps we don't have to follow the route, the same path of Italy?
Well, I think the golden opportunity is always today is better than tomorrow and the day after, because as you know, the growth of infection is, if there's no lockdown, the growth of infection is exponential. And something that you do now to prevent the growth in a day or 2 or 3 or 5 days has more power if you start early. So I think if you get the rapid tests out soon, identify who has the infection, they can self-isolate, or I'm not sure that the current strategy, whether the strategy will change with more people being diagnosed. At the moment, people are going to hospital to be isolated and quarantined. But once more people know that they have the disease and they also have no symptoms, you may end up having to have self-quarantines or accommodation set up for quarantine. You may also have to have more rules and laws to deal with people who are positive about what they can do or can't do and whatever. But I think being able to know you are able to intervene better rather than wait for everything to burst and then catch them as people are falling downhill or whatever.
Yes, the key must be to interrupt transmission of the disease as fast as we can.
Yes, so please stay home and work from home.
Yeah.